Good day everyone. Today, we will be learning about a genetic disease called hemophilia. We'll be answering questions like, what is hemophilia? How is it acquired? What is the fundamental cause of hemophilia? Who are most likely to have this kind of disease? And other important things we should know.
We hope that you will find this video very informative and full of learning.
So what is hemophilia? So most of us may have heard about what is hemophilia, and most of us are not familiar with it. So hemophilia is a type of a genetic disorder. So it is a mutation in the X chromosome. So this genetic disorder affects the body's ability to clot. This is due to the lack of a certain protein called the cloning factors. So this means a person with hemophilia bleeds for a longer time due to the abnormalities in blood clotting. So hemophilia does not only apply in external bleeding but also in internal bleeding, such as internal bleeding in the knees, ankles, and elbows, which could damage the internal organs and tissues. And in extreme level, it may cause life-threatening complications. If you are asking which age group is more likely to be affected with hemophilia, so a person is born with hemophilia because it is a type of genetic disorder. Now, a person can be diagnosed with hemophilia as early as 1 month for severe hemophilia, and 8 months for moderate hemophilia, and about 36 months for those with mild case of hemophilia. So it means that you can be diagnosed with hemophilia at a very young age. So what is the fundamental cause of hemophilia? Hemophilia is caused by a mutation of a certain gene located in the X chromosome. So there is a gene in the X chromosome which is responsible for the formation of the cloning factors. So if these genes are mutated, then the cloning factors are affected. So there are 13 types of cloning factors, and one of these cloning factors is affected by the mutation of the gene in the X chromosome. This leads to a cloning factor that doesn't work properly or a missing cloning factor. Among males and females, males are more at risk of having hemophilia because, as mentioned earlier, the fundamental cause of hemophilia is the mutation in the X chromosome. And as we all know, males only has one X chromosome. Males are X and Y, while females are a pair of X chromosomes. So this means if the X chromosome found in males is abnormal, then the whole body will be affected. So the Y chromosome has no ability to form in forming the cloning factors. So what could be the possible molecules that are affected by the disease or could cause the disease? So the biomolecules involved in this disease is what we call the circulating plasma proteins, also known as the cloning factors. And as discussed earlier, there are 13 types of cloning factors, and one of these cloning factors isn't working properly or is missing, causing hemophilia. So the cloning factors that isn't working properly are the cloning factors affected by the mutation in the gene found in the X chromosome. So there are two types of hemophilia, hemophilia A and hemophilia B. So hemophilia A is the most common type, and it occurs as a result of or a deficiency in cloning factor number 8. So this means during the mutation of a gene for the cloning factors in the X chromosome, the cloning factor that was affected is the cloning factor number 8. So if cloning factor number 8 is affected by the mutation, there could be the result could be cloning factor number 8 isn't working properly or is missing. So there is a deficiency in cloning factor number 8, and it will cause hemophilia A. While hemophilia B occurs as a result of a deficiency in cloning factor number 9. So if the mutation affects cloning factor number 9, so this means the person has hemophilia B. So the type of hemophilia a person has is determined by which cloning factor shows abnormality or deficiency.
Now we are going to discuss the properties of molecules affected by hemophilia. Hemophilia is a genetic disorder that affects blood clotting. There are two different forms. Number 1 is the hemophilia A and number 2 is hemophilia B. Though the causes are different, the effects are the same. People with hemophilia bleeds for longer compared to normal people. So why do people with hemophilia bleed for longer compared to normal people? Hemophilia A and B are caused by changes in two different genes. For hemophilia A, the affected gene is F8, and for hemophilia B, the affected gene is F9. Both of these genes are on the X chromosome. The F8 gene codes for a protein called coagulation factor 8, while F9 gene codes for a protein called coagulation factor 9. Factor 8, factor 9, and other coagulation factor proteins circulate in the blood. So after an injury, coagulation factors in the area became active. Through a chain reaction, the factors work together to send a signal. And in the final step, the signal brings proteins and blood vessels together to form a blood clot. So the blood clot seals off the injury. Bleeding stops and the healing begins. Now let us examine the difference between a healthy person and a person with hemophilia. So both females has X chromosome while males have X and Y chromosome. So in healthy person, there is at least one copy of each F8 and F9 genes. So these genes code to a coagulation factor proteins called the factor 8 and factor 9 that circulates in the blood with other coagulation factors. So after an injury, so when an injury happens, factor 8 and factor 9 proteins come together, relaying the signal to form a clot. So that's how the F8 and F9 gene that codes to factor 8 and factor 9 proteins work together to form a blood clot after an injury. Now let's go to the person with hemophilia. So as you see, there is no working copy of F8 and F9 gene. So this is the reason why that there is no code for a protein called coagulation factor 8 and factor 9 proteins. So this results to too little protein, no protein or altered protein, which is not enough after an injury to relay the signal, and thus the blood does not clot. So that is the difference between a healthy person and a person with hemophilia. Since F8 and F9 genes are on the X chromosome, hemophilia is inherited differently in males and females. As long as a person has a working copy of allele of the F8 and F9 genes, their blood usually clots normally. People with hemophilia, on the other hand, have only non-working alleles of either F8 or F9 genes, meaning they are missing either coagulation factor protein 8 and 9. So some have less working protein than usual and others have none at all. So these are rare cases. So either way, the coagulation factor signal chain is cut off or weakened. Thus, a blood clot cannot form at all. So without a blood clot, the injury is not sealed off and the person continues bleeding. So that explains the affected genes when a person has hemophilia. Now let's discuss the inheritance of hemophilia in males and females. So X and Y are the sex chromosomes and they specify whether a person is male or a female. So boys inherit their single X chromosome from their mothers. Girls inherit their X chromosomes from each parent. So from the perspective of having a genetic disorder, so let's just put that a person is having a genetic disorder. Hemophilia follows an X-linked recessive inheritance pattern. So boys with hemophilia inherit a single non-working allele of either F8 or F9 from their mothers. So for a girl to have hemophilia, it takes two non-working alleles. She inherits one from her mother, who is usually a carrier. A girl's second non-working allele comes from her father, who either has the condition or has sperm that carry a new mutation. From the perspective of the protein, coagulation factor is made from each allele a person has. So the protein circulates in blood. In boys, blood contains protein made from their single allele of F8 or F9 gene. So in girls, two forms of protein circulate in the blood, one made from each allele. As you noticed on the picture, the girls and boys inherit different numbers of X chromosomes. Girls get one X chromosome from each parent, while boys get their single X chromosome from their mother, which is usually the carrier. Next is the normal protein expression. So the F8 and F9 genes are activated primarily in liver cells. So F8 is also activated on in cells of the spleen or lymph nodes. Liver cells make much of the body's factor 8 proteins and nearly all its factor 9 proteins. But the proteins do not normally stay in the liver. They are released into another tissue called the blood. Coagulation factors in the blood circulate through all the body's tissues and organs. So if an injury occurs, coagulation factors such as the factor 8 and factor 9, which is a code from gene factor 8 and factor 9, are always nearby. So they become active and help to trigger the formation of a blood clot. Now let's discuss the protein functions and interactions. So when a blood vessel is damaged, molecules spill into the bloodstream that is not normally there. This starts a very complex chain of events. First, a few nearby platelets, so this is a type of blood cell, are activated and they stick to the injury. At the same time, the blood vessel damage triggers a chain reaction in the blood. Coagulation factor proteins sequentially activate one another, though not in numerical order. So the coagulation factor signals quickly leads to a blood clot. So the signal triggers two processes. First, it activates a protein called fibrin. Many strands of fibrin come together into a meshwork at the site of the injury. Second, it activates more platelets, so they get sticky and enter the fibrin meshwork, forming a plug-like blood clot. Most coagulation factors, including factor 9 protein, are enzymes. Enzymes make specific chemical changes to target molecules, which are often other proteins. Factor 8 protein is a partner to factor 9. So factor 8 brings factor 9 and its target protein together so that factor 9 protein can activate its target. So the target is released and it continues the chain. So this interaction takes place near the injury on the outside membrane of platelets. So this close interaction is why missing either factor 8 or factor 9 protein has the same effect. Without factor 8 or factor 9, fibrin molecules are scarce and slow to form. Far fewer platelets become sticky, and without fibrin, they do not stay in place very well. A person bleeds longer than usual, and bleeding can restart after stopping. Blood is lost or it pools in tissues and organs. So too much blood loss can cause weakness and confusion. So excess blood in and around organs interferes with their normal function. So pooled blood is especially harmful around joints where it can do permanent damage. So an injured blood vessel needs to be sealed off to heal. Next is the symptoms and features of hemophilia. So the main feature of hemophilia is abnormal bleeding. So it can range from mild to severe. So much of the variability depends on the specific gene variant a person has. So in mild, the affected person bleed longer than normal after a serious injury or surgery. So some people with mild hemophilia never notice its effect. In moderate, affected people bleed than normal after a cut, accident, or surgery. So they may occasionally bleed spontaneously, but usually there is a known cause. And for severe, the affected people may have many large bruises or bleed excessively for no clear reason. So they may also have frequent, hard-to-stop nosebleeds. So internal bleeding is a big concern for everyone with hemophilia, especially since it might not be noticed right away. In addition to causing blood loss, internal bleeding affects muscles and joints. So in the short term, it causes swelling, stiffness, and pain. Over time, it can damage tissue and lead to chronic joint disease with arthritis-like symptoms. If too much bleeding occurs in the brain, it can cause seizures, paralysis, and even death. Lastly, let us discuss the treatments and how to manage hemophilia. Hemophilia treatments have come a long way in terms of effectiveness and safety. The first treatment is direct blood transfusion, was developed around 1840. However, even as recently as the 1950s, many people with hemophilia died in childhood. In the 1970s, people learned to concentrate coagulation factors from healthy blood donors. So this treatment became safer when we learned to screen for and kill potential viruses such as HIV or hepatitis C in donor blood. Now, coagulation factor proteins can be made without donor blood, making them even safer. Modern approaches to managing hemophilia are aimed at preventing bleeding before it starts. So this reduces joint damage and other effects from bleeding. Most approaches use a combination of medical and lifestyle behaviors. Today, many people with hemophilia lead long and healthy lives. For some, at-home treatment is even an option. Now let's talk about first the medical approach to treating and managing hemophilia. So there are 10 medical approach. Number 1 is regular injection called the prophylaxis. So it is the regular injection of the missing coagulation factor proteins that can prevent bleeding before it starts. So in severe cases, it is done 2 to 3 times per week. Second is injection of coagulation factors can also treat bleeding when it happens. Third, treatment with hormones can stimulate the body to make more coagulation factors. Fourth, injected therapeutic antibodies can do the job missing factor 8, especially in those whose immune systems attack the injected factor 8 protein. Fifth, medicated creams or sprays can be applied to a cut to promote blood clotting. Sixth, staying up to date on vaccinations like hepatitis A and B can help prevent blood-borne infections. Seventh, physical therapy can ease pain from joint damage. Eighth, carefully planned dental procedures and surgeries can help prevent or prepare for bleeding. Ninth, awareness of how other medications affect blood can be helpful since many can thin blood or prevent clotting. And 10th, hemophilia is a potential target for gene therapy. So there are a number of studies and clinical trials in progress. And lastly, the lifestyle behavior. So there are 7 lifestyle behaviors. Number 1, physical activity can protect joints by strengthening muscles and maintaining weight. Number 2, low-impact activities like swimming or biking can ease stress on joints. Number 3, good dental hygiene can prevent procedures that may cause bleeding. Number 4, learning basic first aid like elevating and applying pressure to wounds can help stop bleeding. Number 5, educating friends, family, teachers, and coaches about hemophilia can help them know what to do in case of an accident. Number 6, a medical alert bracelet can tell emergency response teams a coagulation factor injection may be needed. And lastly, number 7, discussions with a counselor can help patients or parents improve mental health, especially when it comes to balancing physical activity with staying safe.
Thank you for staying with us throughout the discussion.